My name is Sarah Merritt, and this is a presentation of Domestic Violence for Human Growth and Development at Colorado Christian University. It is authored by Jennifer Gasalovich, Sarah Dzik, Lindsay Finninger, and myself.
Trauma through domestic violence is a very real issue and has been for some time now. Webster defines trauma as an injury such as a wound to a living tissue caused by an extrinsic agent, which is not what we're going to be looking at today. It is also defined as a disordered, psychic, or behavioral state resulting from severe mental or emotional stress or physical injury, also an emotional upset, which is more along the lines of what we are going for. Domestic violence is defined as the inflicting of physical injury by one family member or household member on another, also a repeated or habitual pattern of such behavior. Though domestic violence is known to happen to women, it is not sexist and does not stop there. Men are also victims of this as well. That being said, it does happen to women more than men. 70 to 85% of battered women experience mild depression. 63% suffer from post-traumatic stress disorder. 47% experience significant distress. A lot of times, the victim does not feel like leaving is an option. And they are left also, once they do leave, they are left with a lifetime of flashbacks, nightmares, panic attacks, and always feeling like they are in the fight or fight mode. Though we have taken strides to bring support to victims of domestic violence, it is a very real issue in today's society, and the trauma of it needs to have more psychological support.
There's a scarcity of research on domestic violence in minority and economically depressed families in America. Because of this, society does not have nearly enough culturally relevant prevention strategies, interventions, and programs to assist minority victims experiencing domestic violence. I'm going to talk about the environmental factors and barriers that keep minority populations from coming forward and exposing their abuse. Some of these factors include that they may have a language barrier or have no access to a translator. They might hold cultural beliefs that their intimate partner violence is normal. They may carry feelings of shame or self-blame. They may fear that more violence will occur if abuse is revealed. They might fear that they will lose a place to live. If they're undocumented, they might fear consequences if found out by immigration authorities. And lastly, a large reason that victims don't disclose domestic violence is fear that they will lose economic support by their abusing partner. These factors affect victims of domestic violence from any cultural background, but as you can see, there are specific barriers for minorities. There's a lot of shame, humiliation, and fear involved in seeking help for domestic violence. Providing culturally appropriate information and support may assist women to seek services that will help them leave an abusive situation. This is a huge issue and warrants the attention of healthcare providers and counselors. Healthcare workers must be asking about and screening for domestic violence during one-on-one visits with patients. They must develop relationships with community resources for quick referrals. And it is our job as counselors or healthcare providers to advocate for victims, especially those who are minorities, because they often have much less of a voice.
Now we are going to discuss the treatment options, interventions, and counseling strategies that can be implemented when working with victims of domestic violence. In order to be able to treatment plan accordingly, the counselor must understand the level of trauma the victim has experienced, the stage of change they are currently in, and why they are searching counseling help. There are several different assessments the clinicians are able to utilize when working with trauma patients. For juveniles who have experienced trauma due to domestic violence, the UCLA trauma assessment is often utilized. However, for adults, there are several self-reporting assessments that can be used. Two of the assessments include the Davidson Trauma Scale and the Post-Traumatic Diagnostic Scale. The Davidson Trauma Scale is a 17 self-report measure, whereas the Post-Traumatic Diagnostic Scale is a 49-item measure. Both of the assessments determine if the traumatic event or events an individual experiences qualifies the individual to be diagnosed with PTSD according to the DSM-5 criteria. Early intervention has been determined to be an extremely important factor for PTSD clients in order to prevent their symptoms from becoming more severe over time. When domestic violence victims seek out help, it is important for the first two steps of intervention to be psychoeducation and safety planning. Provide the client with knowledge of what they are experiencing, as in the abuse cycle, and what trauma is. This helps the client gain power back to themselves in order to make a decision to change. Based on where the client is in the state of change they are currently in, that is how the clinician is able to determine how to proceed with treatment. If the client is in the contemplative stage, where they are still deciding whether or not to leave or to make a change, the counselor can utilize motivational interviewing to help guide them to the preparation stage where they have made the decision to change and they get ready to do so. The next step as a counselor would be to safety plan with the client to make them feel safe when deciding to leave their domestic violence situation. The safety plan could include who they are able to call for help, where they are going to go for their safe places, and how to keep their children and pets that are from their home safe. As a counselor, the Domestic Abuse Resource Center is a resource that provides a strong safety plan outline that can be used as a resource. As a counselor assisting a domestic abuse trauma client, the counselor determines the level of intervention based off of the assessments and severity of trauma. Early intervention includes cognitive behavioral therapy, or CBT. CBT is a type of therapy that helps restructure the brain after the individual experiences a traumatic event. Finally, the counselor, if certified in this specialty, can use eye movement desensitization reprocessing, or EMDR. EMDR is an 8-phase treatment that was developed by Dr. Francine Shapiro in 1987. This type of therapy uses bilateral stimuli to help guide the client through their traumatic event in a safe environment. The purpose of EMDR is to target past traumatic experiences, current triggers, and future potential challenges. Through this treatment, the client should be able to decrease distress from the traumatic experience and provide their views of themselves in a positive manner.
I think we can all agree that domestic violence is a serious issue that leads to many psychological problems. Jenny outlined the importance of domestic violence using past research as support. Sarah Disick talked about the prevalence of domestic violence in minority populations and how the helping professions need to work together to reach these individuals. Lindsay ended with a summary of counseling techniques that have proven to be effective in domestic violence situations, including safety planning, psychoeducation, cognitive behavioral therapy, eye movement desensitization reprocessing, and motivational interviewing. Although there may not need to be further research to prove the significance of domestic violence, there should be more research done on effective treatment techniques and how to prevent domestic violence, especially among minority populations. And here are references.